I've become convinced, like Hippocrates felt many, many years ago, that all disease begins in the gut.
We're going to talk about how the gut influences a lot of things, like a lot of things.
We now fully understand that the set point of inflammation in the human body is dictated by the very bacteria and other organisms that live within the gut. The brain is highly influenced by the gut, and this has relevance for every neurodegenerative condition that has a vowel in its name, basically. We now understand that the mechanism that's leading to Alzheimer's and Lou Gehrig's disease, multiple sclerosis, Parkinson's, you name it, autism, ADHD, is one word, and that is inflammation. Where is that coming from? Well, inflam means in Latin to light on fire. And where is the fire? Inflammation in the body has its genesis in the gut. And that's a big leap for a brain specialist to take, to recognize that south of the foramen magnum are things happening that influence the brain.
In our quest for efficiency in treating our patients, we've tried to observe what has the best effect with the simplest approach. We used to do the immune system first. We would run these elaborate tests which were inconsistent and not very useful if your interest was actually in getting the patient better. And then when we started to embrace the concept that most of the immune system is in the gut and a lot of other things were happening in the gut, we started working with people's digestive problems and their nutritional problems and their gut inflammatory problems and all that first. We saw a tremendous improvement in the overall probably percentage of people getting better, and recoveries were quicker, they were more long-term.
It's a very sobering notion for myself as a neurologist and others. It's a sobering notion for dermatologists to recognize that inflammation of the skin is in fact mediated by the gut. That inflammation in the joints, the province of the rheumatologist, mediated by the gut. That diabetes is an inflammatory disorder, as is cancer, as is obesity. So when we get to the source, which is the gut lining, which is maintained by healthy balance and diversity of the gut bacteria, then we begin to understand why, number one, changes in the gut bacteria and loss of diversity can threaten the gut lining, and number two, how that leakiness of the gut or permeability then mechanistically leads to inflammation, the cornerstone of basically every degenerative condition you don't want to get. All of the so-called treatments that I had been schooled in and that neurologists still continue to pursue are not looking at the fire, they're looking only at the smoke, meaning they are squarely focused on dealing with symptoms that occur because inflammation has done its dirty deed. The diversity of the organisms that live within us is absolutely on the front center of the stage in terms of what we need to preserve and also what we need to expand if we're going to have a handle on these really severe global health conditions that we call chronic degenerative conditions.